Well, there's a lot in all the areas that I've already sort of discussed. There's trials in all of these areas, and some of these trials are maturing. Pier Paolo, how long did the ChemoID trial take to complete?
3.5 years, close to 4.
Yeah. So some of these newer trials that are on the horizon, we're talking about another maybe 4 to 7 years before we see readouts from some of these studies. But there are a lot of promising things on the horizon in all the areas that I've sort of delineated.
And personalizing medicine, I think, is going to be the key in understanding what to do for those patients, especially because the disease is so heterogeneous and one therapy cannot fit all the patients. That's why ChemoID fit really in this picture really well, because it's a way of functionalizing and understanding which chemotherapy works best for every single patient.
Yeah, and
to improve outcomes.
Going on that, I think what I really liked about the platform, and which is why we participated in the study at the University of Cincinnati, is that it's not a snapshot in time, so it's not a sequence, it's not a mutation. It's looking at samples from the patient. And in this case, we did it in the recurrent setting, but you can imagine utilizing it or deploying it in the upfront setting as well. So there are a lot of, I think, ramifications from platforms like this, something that's functional and in real time.
So that can be moved to earlier times and treat patients before with effective therapies rather than waiting that they recur to try to do something personalized like this.